Hello, welcome. My name is Hannah. I am a UK registered nurse and been a university lecturer for 7 years, and I've been an NMC OSCE programme lead. And I share on this channel lots of help and advice, predominantly for international nurses to help you study for your OSCE, but also some study advice for UK student nurses as well. And today I'm going to do something slightly different. I'm going to look at interview preparation and interview questions. So I know from this channel that a lot of you have gone on to get your NMC OSCE exam, and I also know obviously all the UK student nurses once they qualify will be looking for jobs. So interview preparation is a really good subject. It is also really current because obviously the UK nursing job landscape has changed. So there aren't as many vacancies as previously have been in the past, and more reports of both international and UK nurses who have qualified in securing jobs. And you may have seen things in recent things in like the RCN saying how a lot of student nurses who have recently qualified are working in coffee shops and things like that, unable to get a job. So the interview and job market is really competitive. So you want to make sure you at that interview are doing the best you can to secure that post. So in this session, I'm going to look at how questions are asked, what they're based on in NHS and nursing interviews, some example questions and ways you can start to prepare and practice for these. So obviously, if you get down to being shortlisted from your application and interview, that is firstly a really good achievement. It means that you've met everything on that job description essential criteria, in which case they will call you for an interview. So your interview is your chance to demonstrate your nursing knowledge, skills and your values to your interviewer, okay? And questions will assess you against the trust values. Okay, so the values of your trust, the essential job description criteria, and they will also have some positive and negative kind of criteria based on the topics that they were asking you. Okay, so each question is scored at a total number of points. Okay, and there will be, like I said, positive and negative indicators that the interviewer will use to support them in giving those points. So to be successful and to be offered that job, you have to be the candidate that has scored the most points in the interview. That's what the bottom line of it comes down to. So you have to be able to give it everything you've got in that interview to score the maximum number of points. So let's start off by thinking about what your employers, so the people that are interviewing you, what are they looking for in interview? So they want to see if you are the right person for the role. So number one question is, are you applying for this role for the right reason, is what you need to be asking yourself, okay? Are you just applying for every single band 5 role out there because you desperately need a job, which I totally understand, but you should be thinking about, where you will be strongest, okay? What fits in with your existing skills and knowledge and experience, whether you're a UK student nurse and, thinking about your placement experience, or an international educated nurse, thinking about your previous experience, okay? To make sure you're applying for the right reason. They will also be looking at, do you hold the right values? I'm going to talk about values in a minute, because NHS and nursing interviews are what we call value-based. And so you must be demonstrating to them that you match the same values as the trust and as the main NHS values as well. You're going to be looking at your communication skills, okay? Interview is predominantly you demonstrating your communication skills with other people, which is essential for nursing. But so you need to be confident with that and be able to have really good communication skills. They're going to look and assess whether you can work effectively as part of a team, okay? All NHS work, especially nursing, is a team based approach. You have to be able to work as a team. They're also going to be looking like, do you hold the right skills and knowledge for the role applied for? Which is why it's really important to think about your previous experience and be going for jobs which match your skill set, okay? And finally, they will be looking at, are you safe and knowledgeable and professional, and that you can provide that high quality patient care. So before you go to interview, you should be doing some background research and work, okay? You definitely got to put in some pre-work to make the most of your interview. Firstly, I'll always advise arranging a formal or informal meeting or phone call with the person that is the lead contact person for that job on the job description. So ringing up the ward, asking if you're going around having a visit, having a chat with the ward manager. It's a really good way to put the face to the name, to show your enthusiasm, but also for you to get a bit of an understanding about that clinical area as well. You need to read the job description, okay? Highlight the essential criteria. You must be hitting all that essential criteria in your interview, okay? Read about the trust, or if you're going private, the company, what are their values or mission, okay? Every NHS trust in the country will have their trust values. They will be on their webpage. They will be normally sometimes attached to the job description as well, okay? These are essential that you know those trust values, because you need to demonstrate those values in your interview. And also, if you're an international nurse, before you start going through the whole interview process, and if you need a certificate of sponsorship, you should be asking and finding that out first, okay? Because you don't want to be going through all the effort of that interview if there is not going to be any certificate of sponsorship. I've talked a lot about values, and before we get into the nitty-gritty of the exam, values are values are really important. Okay, so there are trust values, but there are also wider reaching NHS values. So these are like really important things to know, because if you're applying for a job in the NHS, these are some of the things that they're going to be looking for. Okay, and it's the fundamentals of our practice in the NHS. So trust values is working together for patients. Okay, so patients always come first in what we do. Respect and dignity. Okay, so valuing every person as an individual. That commitment to quality of care. Okay, so it's ensuring both quality of care but safety and effectiveness of care as well. Compassion, so we need to ensure that obviously compassion is central to what we do, okay, and we can show kindness to people when they need it. Improving lives, so NHS is massively around obviously health promotion, empowering patients and striving to improve health and well-being of people and their experience in the NHS. And then also everyone counts, okay? So we want to maximise our resources. The NHS is not an indefinite resource, okay? So we want to make sure we're being sustainable, we're maximising our resources so the maximum amount of people can benefit, and we're not excluding or discriminating anyone. And on top of your NHS values, you'll have your individual trust values. So these might be 4 or 5 key values which are central to that NHS trust. So values are really important because knowing the trust values and also the NHS values are really important, because a lot of NHS nursing interviews and questions are what we call value-based questions, okay? So these are interviews that are designed to evaluate how well you personally, but also professionally, match those values of the organisation, okay? So you've got to know them in order to be able to work them into your answers, okay? And value-based interviewing is based on the idea that, your organisation wants to recruit people with values that align with that organisation, okay? And like I said, your trust values, every organisation will have a trust value. So maybe one of the first things you need to do when you are got your interview is go to that trust website, find their values, write them down, and start to think about how you can demonstrate those in your interview. And the other form of questions are what we call competency-based questions. So these are obviously designed to show the interviewer and your future employer, how have you dealt with real-life work situations in your career, okay? So you will, depending on the post you're applying for, you will obviously be tested, not tested, but asked questions around the competencies for that role, okay? So if you are going for a Band 5 nurse, your competency-based questions will be around things such as NMC standards of proficiency and the NMC code of conduct. So 2 different types of style of questions that you can expect. So here's just like a general kind of example of that from NHS England. So the value here is integrity, okay? And they've mapped this to the NHS value of commitment to quality of care, okay? And they're looking at this in terms of, is the person open, honest, okay, takes responsibility for challenging inappropriate behaviour, and can receive feedback. So these are the values that they are looking for in you. So they might ask you a lead question, something like, tell me about a time when you had to address a difficult situation with a colleague. Okay, so that could be your question. And these are what we call those positive indicators. So have you demonstrated in your answer that you're proactive and you've identified, that this is an issue and it needs addressing, okay? Have you demonstrated that you also need to be sensitive and tactful when you are raising difficult issues and concerns, especially around working with other people? And are you aware of the potential risk of maybe raising those concerns with the colleague? So being, aware and putting all these things into your answers would what we'd be like ticking off those positive indicators, things that we'd want to see. Negative indicators are things we definitely don't want to see in a person in an interview, okay? A little bit like red flags in your skis, the things we don't want to be seeing. So, thinking about putting that responsibility on someone else. So not taking responsibility and accountability for it. Maybe jumping to conclusions and not listening to the colleague and considering all points of view, and maybe kind of blame seeking others and things like that. So this is an example of NHS England's website. And then if you haven't quite answered the question fully, they might ask you some probing questions, okay? So why was this important you address this situation? What was the potential outcome? So if they're giving you some feeder questions, they're just probing you a little bit further to really demonstrate the importance of those values. So in order to answer your value-based or competency-based questions to score the maximum number of points and to give yourself the best chance at interview, is you have to have actual examples of your practice which you can use to answer those questions, okay? So for example, everyone can talk about being a great communicator and I've got great communication skills and I do this and that and I listen and do all these great things, textbooks answer. But you need to have some kind of example to back that up, okay? Because like I said, everyone can come in and reel off, all the great communication skills they've got. But when you've actually had to use those, what has the outcome been for patient, okay? So you can say, I've got excellent communication skills. I can do this and this and this. And a time where I've had to use my communication skills has been when I had a really upset and distressed patient following some difficult news. And this is what I had to do. And this is what the outcome was. And this is how I've really demonstrated to you how I can use my effective communication to show compassion, NHS value, quality of care, good outcome for this patient, making everybody count. And you see how you're starting to weave in those values with your answers. So if you do not give examples to support your answers, then you will naturally be scored lower in your interview, okay? And you want to be getting as maximum points as possible in order to be successful. So before your interview, you want to think of key examples from your nursing practice or if you're a student nurse, your student placements, okay, to cover these common areas which are often asked in your interview. So communication skills, okay, massive part of our job as nurses is communicating with people, communicating with patients, relatives, other members of the team, huge range of communication skills. So think of some concrete examples of where you have had to use your communication skills in different examples. So maybe in a challenging situation, when a patient was distressed, in an emergency situation, or when you needed to give clear information to a colleague, okay? So when you're thinking about your examples, go all the way back to your nursing practice, So international nurses use everything you've, experienced since you started your nurse training in your home country. Use examples from your nursing practice when you're practicing in your home country, okay? Student nurses, you want to be drawing on examples from your student placements, okay? If you are currently working as healthcare assistants, don't discount those experiences either. You might have a really good experience working as a healthcare assistant where you had to use your communication skills. It all counts, okay? So you want to think of some really good examples, communication skills, okay? Thinking about what you did, okay? What the situation was, what actions you took, what was the outcome, okay? So how did this improve things, You want to think of an example around team working, okay? So when have you had to work well in a team, okay? When have you had to come together and work as well as a team? So thinking about a team working example. You will most probably always get a question on managing workload, okay? NHS nursing, wherever you are, is very, very busy and demanding, okay? Managing your workload, prioritising care, and not becoming too overwhelmed and burnt out is absolutely essential. So think of a time you've had a very busy or challenging shift, okay? How did you manage that workload? How did you overcome potential issues, okay? How did you ensure that patient care was not compromised and safety was maintained? You will most probably get a question around ensuring quality patient care, okay? Absolutely essential that we can demonstrate how we give quality care to patients. Again, you will most probably always be asked a question around patient safety, okay? and raising concerns and understanding when we do that. If you're an international nurse, these things are very similar to your NMC professional value scenarios, which you have had to learn from your OSCE. So don't disregard all that information that you have learnt. You should get a question about how you keep up to date and evidence-based sometimes, or your research and audit experience. Obviously, being evidence-based is essential for patient safety, essential for quality care, essential for making sure we're using resources effectively as well, that we're doing treatments that are evidence-based. So we want to think about how we do that. And we'll talk about that in a bit more detail. You might get a question on how you teach and support others. Okay, and that could anybody. That could be teaching and providing patient education, teaching relatives, teaching junior members of staff, untrained staff, a whole wide range of people. You might get a question on service and quality improvements potentially, not always for Band 5, but sometimes, so what areas of practice have you developed or improved? What things have you changed? And quality and diversity is obviously really important, massive part of NHS values and constitution. So again, thinking about times where you have demonstrated those values as well. So those are really common areas to prep for your interviews. So how do you answer questions? So using the STAR acronym, it's a really good way to structure and answer your questions in these value-based and competency-based examples. It gives a thorough and comprehensive answer, okay, because you want to be given a really, really full and rich answer to score the maximum number of points. Obviously, everything in that answer needs to be relevant and safe and correct as well, to score the maximum number of points. So STAR is situation. So you describe the context or the challenge that you faced, okay? T is the task, so describe what you were asked to do or what your responsibilities were, okay? Action is then explain what you did to address this situation. So that's why it's really important to have your examples, okay? Because this is our action. So what have we done? And R is the result. So what was the outcomes of your actions? And I've done an example here, and you might not be able to see it on the screen, so I'm just going to read through it. So this is using STAR to answer a question around managing a busy or demanding workload. Yes, you might have a question like, give me an example where you've had a very challenging shift. How did you ensure, patient safety was maintained and patient quality of care was not compromised? Okay, so my situation. So I came on shift and there was a lot of staff sickness and we were down to 2 registered nurses and we had post-operative patients in recovery waiting to come to the ward, but we had no available beds on the ward. So that was my situation, okay? So my task, what did I need to do? I needed to ensure that patient safety was not compromised and that the post-operative patients were safely admitted to the ward and received safe and high quality care. So what did I do? So this is where I'm going to draw my example. So first, I discussed with the other nurses on the ward the situation, and we identified patients that could be discharged or were ready to be discharged and could be safely moved to other areas. We also then prioritised the patients who needed observations and support with personal care, and we delegated these to the healthcare assistant. I then rang the hospital senior nurse and explained our staffing situation and if any staff could be moved to support us. I then rang theatres and recovery and explained that we needed to make beds for the planned patients, but could they be prepared to keep them in recovery slightly longer than normal until a safe patient-staff ratio and beds were available on the ward. I communicated with the discharge team and the bed management team and identified our patients waiting for discharge and prioritised them to be discharged. I ensured clear communication documentation was maintained, updated my colleagues on the plan, and keeping the bed information system and whiteboard updated. What was the result? So we were able to safely discharge 3 patients. We got a nurse redeployed from another ward. We accepted all our post-operative admissions, and we were able to provide safe post-operative care. The team felt that they were well supported and communicated clearly with, which helped reduce any potential stress of this situation. So what I've done in that scenario and answered that question is, and I've put those in red here, I've kind of really demonstrated some of those core skills, but also values. So I've demonstrated working together as a team by communicating with the other nurses. I've demonstrated my ability to understand safety and prioritise patient needs, okay? I've demonstrated my skills of delegation, so realising what can others do in my team to support patient care. I've demonstrated that I understand the importance of raising concerns and accountability. So I'm really concerned about the staffing levels. So I've escalated and raised that to the senior nurse. I've demonstrated the need to have safe patient-to-staff ratios, okay? And I've demonstrated good communication and documentation skills through communicating that with the team appropriately, keeping everyone up to date. So that's an example of how you can use STAR. And these things you can pre-prep before your interview. So your interview will have some what we call introduction questions, starter questions. So these are normally opportunities just for you to show your experience and how it aligns with the job description. So you might get a very simple question like, tell me about your nursing career and experience to date, or why have you applied for the job? So this is your opportunity, number one, to sell yourself, okay? So consider all your existing knowledge and skills and experience and what these can offer to the employer, okay? So don't think anything is too small, okay? Go right back from the start of your training as a nurse, okay? Everything you've worked in. If you're an international nurse, give details of what your nursing career has been like in your home country. What's the speciality? What type of, patients did you look at? What were your roles? Someone in the UK might not have a really good understanding of your nursing role, knowledge and skills from outside the UK because we're not familiar with the education in countries outside of the UK, okay? So be really, really thorough, okay, and give lots of depth about how amazing you are and make sure you're aligning it to the job description, okay? So whatever job you're going for, make sure you focus on skills and knowledge which align to that job description. Like I said, you're bound to get a question on communication skills. So you might get a competency-based question. So tell me of a time when you've had to give difficult or upsetting information to a patient. What communication skills did you use and what was the outcome? So that's a great opportunity to use that STAR acronym then. And you've got your pre-made communication skill example you've had thought about beforehand, okay? You might get a values-based question where you're given maybe more of a scenario. So you're working with a nurse and you overhear them being dismissive to a patient who has recently received some bad news. What would you do? So these questions, again, if you're an international educated nurse looking at these, they're like, oh, they're very similar to the NMC professional value OSCE stations, okay? So those are really good things to review, okay? The marking criteria of those are really good things to review for your OSCE. From your OSCE before your interview, because you might get a series of value-based questions which are all around professionalism, checking you understand your accountability, knowing that you can raise concerns, that you can challenge poor and unsafe practice, okay? So those are really great to refresh yourself on for these value-based interviews. Like I said, you will most probably get a question on workload, okay? So it could be, can you give me an example when you've had a difficult and busy workload? What did you do to ensure quality patient care was not compromised, okay? And that example I just gave a minute ago kind of covers that as well. So workload is normally very current in NHS interviews. Teamwork. So again, a competency-based one might be, can you give an example of when you've had to work together as part of a team? You might get some other probing questions then. So what skills did you use? What was the outcome? Okay, so again, you might have a shift when you were very busy. Maybe you were short-staffed. Maybe you had a very, it could also be linked to challenging workload and you've had to come together as a team, thinking about those skills that you need to work effectively in a team together and demonstrating those. Or maybe we've got more of a scenario. So it's a busy shift and the unit is short-staffed. You notice one of the healthcare assistants is just sat at the desk talking about her plans for the weekend. What would you do in this situation? Okay, so thinking about how this person's behaviour can impact on patient safety and quality of care. Okay, so we always want to think about that and get those into our answers. Thinking about how maybe this healthcare assistant isn't feeling very well. Maybe we just need to check in on her first. Maybe she's not really aware of what needs to be done or that the ward is short-staffed and maybe we need to communicate that with her. Maybe she's new and we just need to give her some supported, more guided delegation. So thinking about all those skills that we could do. Again, we'd want to maybe escalate this at some point to the senior nurse as well. And then safety. You might get a question on safety and nursing competence. So you could have a patient deterioration scenario, okay? So for example, you'll this is based on outpatients. So I was helping someone with an outpatients interview recently, but you're working in the outpatient department and a patient relative calls you as her husband has collapsed. Please outline how you'd respond in this situation. Okay, so they're very much looking for, can you deal with these emergency situations? Do you know the algorithm? Are we, we're going to obviously check it's safe. call for help. We're going to assess that patient using that A to E assessment. Okay, so again, if you're a student nurse or international OSCE nurse who's learnt your A to E assessment, this is where it comes into play in these questions as well, demonstrating you can prioritise, assess and safely manage a patient that's unwell. Okay, you might get a question around, you're administering a medication to a patient, they start to feel unwell. They've got some dizziness, some swelling around the mouth. Again, what would you do in this situation? So thinking about your anaphylaxis response, okay, but same thing, going to call for help. Okay, we're going to manage that patient using the A2 assessment and give details on that. And we're going to document this, okay? Both of these situations, we're going to document them, okay? We're going to make sure we follow duty of candour and make sure these are documented and the patient is aware of what has occurred as well and what we have done. So you might get some kind of patient deterioration scenario. Again, keep it simple. Think about those first line assessment skills. Accountability. So again, very similar to those NMC professional values, but again, checking and assessing whether you know what to do, whether you know what is right or wrong, okay, and whether you know how to manage this and what you would do in practice. So, for example, and this one's around confidentiality. We handle a lot of information in the NHS, a lot of personal information. There's UK laws around confidentiality and, we're not allowed to breach that. This is testing your knowledge on that as well. So, for example, we've got a patient who's just received a life-limiting diagnosis. They ask you not to tell their husband. When you take the patient out of the waiting room, the husband takes you to one side and asks you what the results are. What would you do in this situation? Okay, so we're testing you here around whether you understand about confidentiality, how we can't breach patient confidentiality, but what would we do in that situation? How would we try and support both these people so they both feel supported and so thinking about that those communication skills, what we need to do, but also explaining at this point in time we can't breach confidentiality even if it is without someone's consent, even if it is their husband or wife. And again, you might get a question on raising a concern around a colleague's work as well. Again, thinking about your accountability as well. So can you give an example when you've had to raise a concern about a colleague's work? Now, if you're really struggling to find examples for this, maybe you've never had to do it, you could just say, I haven't had an actual example of this, but these are the things that I would do if I was in this situation. You can answer a question like that instead, okay? Like I said, you might have something around information governance, and this is a more again another confidentiality question as well, and this is where you overhear a nurse talking about a patient's results to someone in the waiting room, and when you ask them, they say it was a neighbour that brought them in. So what would you do in this situation? Again, if you international nurses, you'll be very familiar with these from your NMC professional values. Again, values-based questions, you'll have some kind of scenario testing your values and whether you know what to do in a right or wrong situation. So again, thinking about all those things that we do about acknowledging that is wrong, raising that concern, documentation, speaking to the staff member as well. Maybe they were not really aware of that confidentiality requirements as well. So those type of things are things to be thinking about. Like I said, you most probably get a question around how up-to-date and how evidence-based you are. So how do you keep yourself up-to-date with latest evidence-based research? Or how do you ensure your nursing practice is evidence-based? Now, if you're a UK student nurse, you've just done a 3-year degree programme where you've absolutely had to demonstrate you are up-to-date in evidence-based. So you should have a lot to draw on, okay? So all your assignments or your NICE guidelines, policies, everything that you've used to support your academic work is demonstrating your evidence-based practice. You might also do additional things. You might be part of the RCN, or you might get a subscription to a journal. You might make sure you go to relevant study days and training days. If you're an internationally educated nurse, you have just completed your NMC OSCE, okay? So please don't forget about your NMC OSCE and all the work you had to do where you had to demonstrate you were evidence-based practitioner, okay, because that is what you are being assessed on as part of that OSCE. So, explain that. Most people in the UK, if you're not specifically involved in OSCE training, have no idea what the OSCE involves and what you have to do. So, explain, I've had to do the NMC test of competence in this. We needed, you had to do your CPT exam. That's all evidence-based kind of questions as well, yeah? You had to know all your nursing procedures. You had to use the evidence-based guidelines. you had to research certain things for your evidence-based practice scenarios as well. Don't be afraid to use those in. One of the things I learned was, that around, using saline versus tap water for wound dressings, for example. Use your OSCE, yeah? You've learned so much about it. Don't be afraid to pull it into your interviews and demonstrate that up-to-date and current knowledge that you've had to learn. Teaching and mentoring, yeah, teaching is a massive part of Band 5 role in the NHS and in private trusts as well. So you might be asked a question on your experience of teaching and supporting junior members of staff. Again, it could be staff members if you haven't. Maybe you've done some patient education and patient groups. So don't be afraid to use that. Don't be afraid to use things from your home country as well. Any education that you've done, any supporting junior members as well. Show your passion for education. That's a massive part of the role, and it makes a huge difference to future workforce as well. And then, so those are just some example questions. Obviously, I can't tell you all the questions you might get in all job interviews, but they're very core ones around kind of core values and requirements in job descriptions. And then normally you get a final question, like a sell yourself question, yeah? So it could be something like, can you tell me what you will bring to the post that the other candidates will not? Or why should we employ you over the other candidates? So this is your chance to sell, yeah? Make yourself the best person in that interview room that day, okay? So it doesn't matter if you've already said loads of great stuff about yourself, just say it again, sum it up, share your passion, your want for that role, okay? Think about, why do you want that role, okay? Why do you want this job here in this surgical ward, or why do you want this job in this outpatient department? What is it about that speciality which you love? Where do you see yourself in 5 years' time? Yeah, when you're recruiting people, you want them to stay, okay? Recruiting people is really expensive. Training them, you've got a high turnover. It's very disruptive for the team, but also for patient care and safety as well. So you want people who are applying, who are committed to your speciality, who demonstrate that passion, who see and want their careers to involve there, okay? So make sure you get that over as well. Sell them everything which is amazing about yourself, yeah? Everything that you've done, okay? Again, if you're a UK student nurse, you've just done 3 years of your undergraduate programme, that is nothing to be like sniffed at all. It's a massive undertaking. Sell that, okay? Loads and loads and loads of amazing skills you've learned doing that, okay? If you are an internationally educated nurse and you've come to the UK, don't underestimate how much that has taken, yeah? What does that show about you? Your commitment, yes? Your desire, yes? Your, sheer will to be able to complete all the NMC test of competence, yeah? Move to a new country. Those skills, you do not find those in everyday people, especially, so make sure you are selling those things, yeah? That drive, that passion, what you can offer, okay? And then at the end, you might have an opportunity to ask some questions. Normally you get an opportunity to ask some questions. And sometimes people are, I don't know what to ask and not too sure. So, just think about things. It shows a little bit of interest. So you could ask, what does the induction programme look like, for example? Or, thinking about, what opportunities are there for your continual professional development. It shows that you're keen. It shows that you want to continue to progress your career there, okay? Or any other questions. So it's good to have a couple of questions prepped. Okay, if you really don't think you've got any questions and you've done a pre-visit to that area, then you can say, I had a lot of my questions answered when I came and had a look around. I don't have any other questions, okay? But always have your questions that will put you in a positive light, okay? And, thinking about you developing there, thinking about, can be induction programs, supernumerary program, educational opportunities, all those type of things show that you're keen. So finally then, so you're on your day of your interview, you want to arrive early, okay? You should dress smartly, okay? So you don't need to be suited and booted, but, make sure you are dressed smartly, your clothes are ironed, your clothes are clean, you've got, sensible shoes on, and you've not got, loads and loads of jewellery all over you. Think about the clinical area that you're going into. Try and keep your nerves under control, and don't be afraid of saying to your interview team at the beginning that you're feeling very nervous, okay? They want you to have a good experience, and they want to, they'll be understanding of that, okay? If you're having an online interview, double check all your tech in advance, okay? Make sure it is all working. I would also advise you to put a background blur or a filter on your screen, especially if you haven't got a clean and decluttered kind of background. So it can just be a little bit distracting sometimes for the interviewee. And if you're not successful, get feedback, okay? Like I said, the job market is much more competitive now for nursing, okay? So you want to know why you didn't get it, okay? Could be that someone much more experienced for you, in which case that would most probably come through in their answers and they'd score more points, okay? But you want to use that to reflect and to help you with future interviews, okay? Every interview is a learning opportunity, okay? Going through that experience is a learning opportunity. But also remember that not everyone is shortlisted. So just making it to interview is a good achievement. And you are demonstrating that you have got everything they are looking for by getting to interview, but then you need to demonstrate it in person, okay? So your application is demonstrating it on paper, but in your interview, you need to demonstrate it in person. So my top tips is do your preparation work, okay? Find out about your trust or your company that you're going to, if it's private, their values, okay? And the role that you are applying for. Read the job description carefully and highlight the key requirements and the essential criteria. Make sure you're covering all of that in your interview. Think of good examples for those common questions and themes that we have been through, okay? Really good examples that demonstrate your nursing knowledge and your previous experience in those situations. Use all your past nursing experience, either as a student or in previous jobs, okay? You want to be giving it as much as you've got, okay? Be confident. Show them you are the best person for the job, okay? Think about your body language. Think about your communication. You want to go in there feeling really confident. I hope that's helpful. Do some private one-to-one tutoring for interview preparation. So for international nurses and also UK student nurses can look at CVs as well. And we can practice interview questions. If that's something that you feel you would benefit from, then give me an email at hannah.lames@outlook.com.